This presentation, Predictive Model for Diabetes, was prepared for HAP 709, Healthcare Databases, a health informatics course taught by Professor Alemi at George Mason University in the Department of Health Administration and Policy. The presenter is Christina Lee, a student in the Health Informatics Program, graduating in 2020. There are 30.3 million people who have diabetes, which makes up 9.4% of the population in the United States. Of the 30.3 million, 23.8% or 7.2 million people with diabetes are undiagnosed. Therefore, it is important to screen for diabetes to ensure that we keep this percentage of those undiagnosed low in order to take the necessary precautions to avoid any added serious health issues. We can do this by calculating a patient's likelihood of contracting diabetes and/or the odds of mortality through the relationship applied to a patient's medical history in the electronic health record system. In order to test this model, we use simulated data from a major healthcare institution in the United States. The data consisted of 657,940 unique patient IDs and 17,441,585 patient records. According to Medline Plus, diabetes, also known as diabetes mellitus or DM, is a disease in which your blood glucose or blood sugar levels are too high because your body is either unable to make enough insulin or can't use its own insulin as well as it should. In order to create our predictive model, we define diabetes using the Agency for Healthcare Research and Quality Clinical Classification System using specified CCS codes. A comprehensive set of diagnoses, meaning all types of diagnoses, were used to predict the presence of diabetes or the risk for diabetes. In using such a comprehensive set of diagnoses, no relevant piece of information is missing from the model and is therefore more accurate. 100,846 diagnoses with at least 29 observations were identified, and age and gender were added to these predictors in order to avoid further track specific relationship trends within the model. Here are some of the diagnoses that are obvious in terms of showing that an individual is diabetic given the name. These were not included in the definition of diabetes, but were kept in the model because removing these obvious diagnoses can cause errors in computational accuracy, and obvious predictors can adjust for missing crucial information. Here is a list of the top 10 rare diseases or diagnoses that occur more than 29 times but less than other diagnoses. It's important to incorporate these rare diseases into any research model as it gives us more information regarding disease outcome and treatment, and also allows for accuracy in those patients who may have those rare diseases. And here's a list of the top 10 most predictive diagnoses that were calculated in the model. These diagnoses had likelihood ratios that were closely associated with the diabetes and are therefore important. The naive Bayes formula, also shown above, was used to predict the probability of diabetes in our predictive model. We use this formula to aggregate likelihood ratios from several diagnoses in order to show a patient's odds of diabetes. In taking the model a step further, I use patient ID 801486 to display this individual's odds of diabetes. This patient had 5 diagnoses associated with their medical history, and the likelihood ratio for each of these diagnoses are shown in the middle. Using the naive Bayes formula, the calculated odds of diabetes is shown on the right side. Data was set aside for cross-validation by first taking 80% of the data to estimate likelihood ratios and were grouped as a training set of data. The other 20% was set aside for validation. By cross-validating data using this approach, one is able to verify the error performance within the model and to validate the training data set via the validation set in order to better assess the predictive performance of the model. Predictors that occurred after diabetes were ignored in the validation set because we wanted to make accurate predictions rather than find who already had diabetes. The receiver operating curve, or ROC, shown here is a curve used to graphically show the connection between clinical sensitivity and specificity for every possible cutoff for a test or combination of tests. Sensitivity is a true positive rate, or the probability of detection whereas 1 minus specificity in the graph is a false positive rate or probability of a false alarm. The area under the ROC curve measures the usefulness or the accuracy of the test, where the greater the area under the curve, the more useful or accurate the test or model. The area under this receiver operating curve is 1.375. As in our previous slide, the result of the accuracy of the curve was 1.375, which is equal to 137.5%. Given these results and what was presented throughout the presentation, I believe that there is still more work in perfecting a tool of this sort to accurately predict and screen for diabetes, but it is definitely doable. With the future moving into more comprehensive and advanced electronic healthcare records system, we will be able to apply several calculations into managing and presenting a variety of predictive models using a patient's medical history to better the healthcare world. This concludes my presentation on a predictive model for diabetes. I hope you enjoyed it. Thank you.